Robert, hi, and thank you so much for joining me on Faces of Digital Health to discuss a little bit where AI is at the moment in healthcare. I really wanted to speak to you to just kind of stop for a little bit and reflect on where we've come with AI. How is it impacting vendors in the way that they're developing healthcare IT software? And also, how is it impacting the users? How much clarity do we actually have? How much more confusion do we have because of the proliferation of AI tools? So to just kick things off in an easygoing manner, how would you reflect on the last 3 years of development since GPT-3 was first released to the public to 2026?
First of all, hi Jasha, and thank you for having me. In the beginning, when these GPT models were coming out, we were impressed by the technology. And we were trying to evaluate, okay, what are the model's capability, how well it can answer things, is it reliable even then? But at that point, you knew that this was a new technology, so there's some unreliability connected with it. The shift that I've noticed that now it's no longer so much about the model because the models are slowly evening out. So whichever, of course, we're speaking of frontier models, not just every local model that we develop our own. They have a quite matching capability. So now it's not so much about how smart they are, but what can they do for us? Are they consistent? Do they understand what we ask them, the context? So I think the shift that's coming is moving back to data and the context much more than the technologies themselves.
I didn't mention earlier, but you are the innovation lead at Better, which is a healthcare IT company building software based on openEHR. So your job is to daily follow the trends that are happening in AI. How can you use it? How has your work changed in the last 3 years? You mentioned that when GPT-3 was released to the public, everybody was somehow impressed, but it took quite a bit for everyone to realize how to use it on a personal level or even to demand the workers to use it, especially if you do software development.
There's so many more ideas that you can explore because they really boost your productivity. But it does come with understanding them, what their use is, how you can use it. Also, when you're discussing ideas with others or like clients or a new product that you're trying to develop, it becomes so much easier to show the first version. Even if it's shit, it helps you find the common ground. And then you have something that you can discuss. It's no longer us discussing ideas, but we have a product that we can both look at, maybe even test it, and then discuss what we actually want from the product.
So if we try to be a little bit more concrete, when we talk about product development, so what has actually changed? What are you doing differently? Because especially in software development for healthcare, the collaboration with clinicians is still crucial. You still need to discuss with end users how they work, to understand their workflows before you start building.
The point of the product is always to ease some pain or solve some problem that we have. So that stays the same. You still have to communicate with clinicians. You have to gather the requirements, what's something that they want. I would even say that maybe we're even making more of an effort to make sure that AI is not the front part of the problem. It's like we're not solving this solution because of an AI. We're using AI because it can aid in this solution or part of the solution to use it. Of course, you have to add some of your insight because if you don't know the tech or its capability, it's difficult to imagine what problems it could solve. Now, I think sometimes the technical stuff is starting to feel the pain of the doctors. You know, before you were the technical guy, you knew everything that was technical, and it was a surprise if a client knew anything about technology. And now sometimes people come prepared. They use AI to understand, okay, this is the stack we could use. Maybe we could do it this way. And then you sort of get an informed opinion ahead, which sometimes is off, sometimes it helps. But I think we're starting to feel the pain of the clinicians that get the patients informed that, okay, these are my symptoms and this is my diagnosis. And you understand that sometimes that part actually takes more effort than if you just start from the scratch.
Okay. Yeah. So people can prepare in advance even before they're meeting you and discussing what the technology could do for their challenges. But one of the things that I'm wondering if it's still prevalent is the depth of the understanding of how this technology works. When we use chatbots, when we use large language models, there can be this perception that everything works seamlessly because we are saying that AI is a black box and nobody understands how it works. However, there's tons of editing and modeling happening in the background. So if we go into the technical details a little bit, what do you need to do manually for the technology to work? For example, openEHR is based on structured data, so somebody needs to design the data models and the archetypes in the background. When we talk about data standards and terminologies, somebody still needs to define those terminologies and to a degree manually mark what means what before technology is developed. So from that perspective, has anything changed with the AI in terms of how you apply the terminology to software development?
You can easily get impressed because a lot of these things come out of the box. Like if you ask ChatGPT what's the ICD code for something or what's SNOMED code for something, it's very quickly going to generate an answer. But the question is the answer right? And what data did it use? And for example, clinical coding, the codes have to be active. Is this a code that you know that it's active, or is this something that is already out of order? So I think the shift is you have to develop independent of the model. If the model is smart, then just make things easier. But anything that you can leave to a deterministic system, it's still better to leave to a deterministic system, meaning you still work on the context. So you have services that provide you ICD-10 codes. You have services that provide different terminologies. And the way of doing this automation is not to just ask ChatGPT and hope for it to do the whole job on its own and get everything, but give it the tools, enable it. This is where you can find terminologies. And you have to use this tool in a specific way so that we can also verify it, that the information is used. Of course, it's making things easier because it's starting to understand our language. It's very important that it understands context. So I would say that at this stage they're more in finding information stage, trying to guide you to where to find the information, retrieving them. But I wouldn't leave anything of inference to the GPT models. It's like, models are very eager to please and they want to answer a question. And if you give it a simple data, like this is blood pressure, 130 or 150 over 90. What's the diagnosis? It's going to quickly answer, okay, the diagnosis is the patient has hypertension. When you talk to people on medications, that's not the response you'll get. First, it will be, okay, what's the context of the information? Was the patient sitting? Was he standing? Was he just waking up from sleep? Was he running before? What was he eating? So all the factors that can influence the decision. So the shift is definitely going into the direction of, okay, we have to handle the context. We have to enable models to work in an automatic way to help us. So they're really good at finding information, doing it really fast, sorting out different combinations, and then providing that information to us so that we can still make the decision. So that's a sort of a shift that we're seeing. And it's also one of the only ways I think that you can get, because also, like, how do you estimate if you got the good answer?
Exactly. That's a great starting point for just the broader discussion of when can you know that you actually designed a solution well. So, for example, what you were describing to a degree is, I assume, using different agents that you give very specific answers and resources to. So for ICD codes, and then connecting that to something else in order to get an actual specialized solution. But how do you know that you gave AI enough context for the solution to be sound? Because it's one thing to just experiment and to know what the potential capabilities of AI are. It's a completely different thing to be confident enough to put something in front of a myriad of users, especially in different healthcare institutions, in different hospitals, where they use different protocols, they might think differently. So how are you balancing those dilemmas?
Yeah, one of the things that I keep in mind is the pace of development. So AI technologies develop really quickly, while clinical standards, they take time to develop and they don't change really fast. So the first thing is you kind of want to have that separation between the model and the data that you're working with. How do you decide whether the model works fine? Before it was easy because most of the programming and the technological development was deterministic. You could look at the source code, you could set up a simple test and you would know, okay, if this is the input, this should be the output. With AI and LLMs, the game is changing. They're to some degree very undeterministic. So you can't say, okay, in this case, this should always be the output. Also, how do you validate that? Because it doesn't come in the shape where you could just say, okay, this is the correct answer. Once I got a question from a doctor, how do you trust AI? And I asked him, how do you trust your colleague? It's experience-based. That's the shift that's happening. Before you could be deterministic, now it's going into experience. So you have to play around with the systems. You have to know its perks, what it's really good at. Maybe it's really good at creating summaries and doing clinical coding, but it really sucks at making any kind of diagnostics or thinking, okay, this is how the lab should work. You have to know its challenges. You have to know how to test it, and that you can only get that knowledge through experience. And over time, you see where it's good at. One thing that I like to do is test its reasoning and see how well it works. And one simple trick is to try to understand if it understands the importance of its data. So when you first ask a question, it should go through the sources, find the sources, provide you an answer. And then I always accept the answer and I come up with a follow-up. Okay, are you sure about the data? Are you sure about the answer? And then you see two things. On what I would call good systems, they would revalidate everything. So go back, see if they understood the user's query, see if they pulled the correct data, and then they would say, okay, I've revalidated, this is acceptable, and this is good. So you're looking here for consistency. What less of a good systems would do is they would just, and I've had this happen, it would just check its own reasoning. So it didn't go back to check the data it didn't do anything. It just went, okay, this was the user's questions. I think this is how I understood it, and this is how I answered it, so everything is good. So basically it caught itself in a loop without getting any validation. So the main shift is we have to work through experience. That's how we go. You have to work on the context. You have to set up scenarios where you know how it should work. And then you look for loopholes. Did it work as you predicted? Did it start changing? And over time, you get to a point where you see that system is constricted enough and it's starting to perform in a way. But yeah, I think grounding it, reliability, understanding what kind of data it was trained on, what kind of data it has access on, what data was used in a single answer to provide that feedback, any presumptions it made.
It's interesting how you are, in essence, describing trust. So you just explained to me what are the safeguards that you use when you are developing tools. And because I know that, and because I trust you, I'm going to trust whatever you put out there, if that's a solution that I'm going to use as an end user. Obviously, on a large scale, it's not sustainable that all the users are going to talk to you directly to understand that they can trust you and that your solution is good, which is, I guess, where the regulation comes in. So how do you see the current approaches to AI regulation? So easing the trust for solutions, so we don't need to get to know every developer in person to be able to be sure that what we're going to use is solid.
Exactly. So this is the part where community steps in. So, this is going to be shared experience. You can test everyone. You can talk to everyone. You do have to build up some trust. So this is like what will be the shared experience with different models, with different systems, how they work. Regulation, it's really important. Why? What can happen over time? The automation bias. You stop checking. You just say, okay, the system works well. It always worked well. And it should work well in the future. But that's something that you can't leave to chance. So that's why regulations are important. There are rules that have to be followed. Some retracted from Europe because following these regulations is a lot of work and a lot of also financial burden. But they are important because these are strong and powerful systems, and we have to know their strong and weak points, and only through regulation you can do that.
What are you currently following most closely when it comes to trends and the development of AI?
What we're seeing and what we're slowly aiming towards is what we say conversational EHR. So that, one of the limitations is when you develop applications, or how we used to do it, they were very monolithic. So one backend, one front end, and then some user app that communicates, of course, in the background with the data. Now we're slowly shifting that because there is no more, the agents are slowly coming and they're replacing the backend, or sometimes within the front end, the backend. But the problem is that if you miss some requirement with the clinician or the doctor or whatever kind of use case that you are defining, and you forgot to add that button into the interface, there's no way that the user can access that data. Like we had this one example that kind of opened our eyes. You have the history of the patient, like all the medications, when he's inpatient, all the medications he got, the treatment he got on each day. And then the shift changes between the doctors, and the question comes, what were the changes? You have all the info there. You have the data from the previous day, you have the data from the next day, or the whole interval that you're trying to follow, but you can't get an answer because there's no button. And to do that change, that's going to take a lot of time, a lot of work, a lot of validation. So what we're trying to do is add this other level that's conversational, which would allow you to work with the same systems, but broaden the application to meet the needs of everything that the interface cannot offer. So all the little tests, of course, it has to work in the same system. But with that in mind, I think that what we're seeing today is slowly going towards this omnipresent AI that will not do everything for us, but it will be there to help us, to listen to us, to assist us.
You kind of raised a very interesting point, which is how difficult it is to add a button in an existing software. Many people are vibe coding today, vibe coding their own apps. And when you do that, that's super simple. Like, you have an idea of the app that you want to have. I recently did I wanted to create like a database that would be easily searchable, and I said this is what I need, and then like slowly through iterations I realized I actually want this button as well, I want this button as well, I want this to be editable, which with vibe coding is super simple. It's like one prompt, in half an hour the solution is there. But when we look at the clinical software, to which extent can you iterate the EHR or any other solution when they're already deployed, when they're already embedded in other systems? Any thoughts?
We're really lucky that we're working with openEHR, because on its own, it's already a standard that contains a lot of information about its the data source, how something was captured, where it was captured, who the person involved was. So that's a big leverage for us. And what we're doing is, instead of focusing on technology, we're trying to understand what kind of a platform or what kind of an environment would AI need to be able to perform tasks in a controlled manner. So to have a system making sure that data is AI ready, meaning it's well described, the context is available, it's grounded, and then trying to build a system that can interact. How can it access the data? What kind of context is building? What kind of use case are we addressing? And this is, I think, much more important, because you can see that when you do that, you can use much smaller models, much simpler models. Instead of having one system that can do SNOMED coding and a summarization, and you decide, okay, no, this system is only for coding, and it really it understands coding systems really well, and that's his task. And then you have a different system that's for summaries. One thing that you also mentioned, this with vibe coding, I think it's just supporting this need that we're seeing, because I've also watched some series from Anthropic with AI clinicians, and they were all vibe coding. And the main thing was that they were using the same data sources and same stories, but they wanted to present them in a different way. And, for a clinician, this is important. For a dermatologist, there's a different information that he'll look in an AI summary. A psychiatrician, he'll look for different information. So I think the focus should be building a system that kind of allows customization or personalization, but still works within an existing system. It's like being able to create a personal assistant for anyone.
Yeah. It's it kind of brings me back to the question I had in mind earlier. Is frustration between what we see AI doing as consumers and how slowly our IT systems in healthcare changing, is that frustration bigger, or are you actually able to use AI to create changes faster for the end users? So how close are we to the point where clinicians can easily iterate the solutions that they're using if the underlying data structure is solid, and if there's a platform that's kind of enabling them to build tools on their own?
I think that there's two sides. Like, it's not gonna, just because there's AI, it's not gonna change super fast, because these are still controlled environments, and there are processes in place that take time, and it doesn't really speed up that part. What AI is doing, especially with this general availability, it's helping, because users are already using it, meaning they're building experience before the systems even catch up. So hopefully they will already understand some of the strengths and weaknesses of these systems when they will start using them. It does help, as I mentioned before, bouncing ideas. So how quickly you can get to a certain idea. And of course, it's frustrating, because if you can build an idea or customize something for a doctor in like a week, and then like we had this one example when we were exploring ambient scribing, and we were doing this, I don't know, 3 years back, and we built a solution in like 2 weeks that worked. And we shared it with some Indian friend, and like months later he came back reporting that he's already using this in his private hospital setting, because it's producing really good results. Of course, there are some mistakes here and there, but it's helping. But the difference is there's not so much regulation in India. And then when you have the same product that you would try to use in our hospitals, it takes time. Like Slovenia even has these laws that data can't leave the country. So that's some issue that's going to come up, and there's going to be ways to handle that.
Yeah, absolutely. Different countries work differently, which we also discussed earlier a little bit regarding the regulation and the importance of it. If we try to wrap up a little bit, what expectations do you have in terms of the AI development that we see and what healthcare could expect from this AI boom in the upcoming years?
What expectation do I have for the AI boom?
Yeah. Is there anything you look forward to? Is there anything you are afraid of? Is there anything that concerns you? We talked a lot about on the one hand software development, on the one hand the importance of data, on the second hand how people are using this even if they know that things are not validated or regulated or certified. So there's like plenty aspects to choose from.
I think the systems, the processes will improve. Data quality will definitely go up because, this has always been saying in AI, bad data goes in, bad outcome comes out. So that's something that will definitely improve.
So do you anticipate that institutions are going to invest in the data layer and data standardization and the prep part that needs to happen before you start using AI on top of the data?
I think that's a necessary step that they'll have to do because it's the only way that you can control AI, because it lives off of data. It starts from the beginning as to how what data the model was trained on, then what kind of use cases it was presented to for different fine-tuning sessions. So the work on data is going to be inevitable, and that's also going to be the main differentiator, I think, between good and bad systems. Like we already see things like open evidence, evidence hunt, working on making sure that the data is of quality. They have regulations that they can follow, and that they are still maintained by providers, not by AI. So the data part of change of the organization is inevitable, I think. Of course, it's going to be limited by how much funding hospitals have, how much they can put into this. But as I mentioned, I think it's slowly going to transition into this ambient AI. Having personal assistants help you out to, just perform better, hopefully with with more ease.
Mm-hmm. So you mean not just for AI scribes as we know them at the moment, but for anything that you want to do, that you just say that something needs to be done and it's done. Like, I don't know, make an analysis about this patient even before they arrive because I'm going to see them in an hour type of a thing.
Yeah, exactly.
Saying
And
that instead of writing it up or doing your own research.
that, or spending a week with your system, teaching it what you need. Like when doctors prep for an operation, there's data they need, and often they don't have time to go through the 10 years of medical documentation. So being able to quickly be guided, okay, this is the relevant information you need, this is something you should be aware of, that's definitely gonna help out. Then also in the big scope, one thing that AI is really good at, it doesn't forget things. And it's really good at exploring different combinations. So, different areas of healthcare. My biggest hope in some point is digital twins, being able to create a simulation of you from a bit of DNA or something that's going to be amazing. That's going to be a big booster because then you can tailor medications, processes to individuals. But of course, it's a few steps out. In the short term, as I mentioned, I think omnipresent technologies, different assistants to help you with your workflows. It's also a bit difficult to say because these are evolving systems. We don't know. Just the question of, I'm going to go into a bit technical, but let's say you're trying to solve a problem. Do you solve it with one agent that does everything? Do you solve it with a few minor agents? Should the agent tell another agent what to do, or should it ask it how it wants to complete the tasks? And that's something that we're all discovering as we're going in this space, because it's not an exact technology, it's experience-based. And then based on the experience, we can start understanding technology, setting up regulations, the rails of how it should perform. That's why it's a bit, I would say, uneasy to predict. But
Yeah.
My biggest goal is like, I don't care about AI. Is it solving a problem or not? That's something that I think we should be striving for, and knowing what kind of problems it's good at and for what kind of problems it's success.
Absolutely, making sure that it fits the purpose. Robert, thank you so much for taking the time for this chat, and I'm sure we're gonna speak soon again.
Thank you very much, Yasha. It has been a pleasure.